The blood vessel is the dermis. This is where all the blood vessel all goes. It's in the middle. Yeah, it's the dermis. Yeah. So what's the different?
I think that the subcutaneous tissue is more directly
And
connected right into the blood vessels than the
and
dermis than the dermis.
the epidermis, which is the middle.
I think it has to do with the connection.
No, I think
All right.
it's the
So
blood
you're going to
vessel
break
here.
it down a little more for understanding. Which layer of the skin is vascularized? Vascularized means you having blood vessels. So which layer of the skin has the most blood supply?
The dermis.
It is.
So no.
No. It's the dermis.
Which layer of the skin has the most blood vessels?
Epidermis, dermis.
One moment. I found this on the web.
The dermis.
Yes, that was right.
The dermis.
That I know this. I know this by head because my friend, he went over with this
You what?
over and over and over. Remember when
Oh, right.
what's the name of doing it?
Yeah.
When she stopped doing it?
That's why you call it the true skin.
Right.
Dermis, because it has pretty much everything.
Everything on it. And the blood
So
vessel.
now we go back to the same thing. Why can't we use the subcutaneous tissue? And remember also, you have something called insulation. Fatty layers insulate. That's like how you got a house, you put insulation, warm, and therefore, that's the we're talking heating. I'm talking about adipose tissue. Where's the adipose tissue located? Where's the adipose tissue located? And what is the adipose tissue?
It's around this like
Where is the adipose tissue located?
What is adipose tissue?
One moment. Here's what I found from
In the
Wikipedia.
human
Part.
adipose tissue is beneath the skin.
Adipose tissue is located.
Subcutaneous fat.
Subcutaneous fat around internal organs, visceral fat, bone marrow, yellow bone marrow, intramuscular, muscular system, and in the breast tissue.
What is adipose tissue?
Here's some information.
Body fat or simply fat. The loose connective tissue composed mostly of adipocytes. In addition to adipocytes, adipose tissue contains the stroma vascular fraction of cells, including pre-adipocytes, fibroblasts, vascular endothelial cells, and a variety of immune cells, such as adipose tissue macrophages. Adipose tissue is derived from pre-adipocytes. Its main role is to store energy in the form of lipids, although it also cushions.
Tissues are unloved.
It's fat.
It's fat.
It's the fat.
That's the question I asked.
You say what is adipose tissue and where is it located?
So where's it
Right?
located?
It's located
Under
many in different places. It's in the internal organs, bone marrow, muscular system. It's all over. But it's
all over the
fat.
body. It's
Adipose
fat.
tissue is basically fat.
There's an
We're talking
organ
about fat,
between
right?
the muscles and
There's some fat subcutaneous layers, right?
So what?
Get the connection.
So when you do the hypodermal crisis, was that
yeah, how about that?
when you do the hypodermal crisis, you are
Remember, it is not just about the hypodermal
Crisis.
Right? What has fat to do with you? as a person. We talk about grams, we talk about 9 calories. We even look at the keto diet, which use more fats. And we talk about the storage. You said specifically women have it in their buttocks and in their thighs. There is a connection when you go to genetics, when you go to the aging process. All of those are connections with fats. See, a lot of older people, they start losing what? They start getting thin, right? You have some persons with an increased BMR, they start to get what? Thin. Start to burn up those fats. Because if the carbohydrates are being cut back on, then you're going to what? And one of the things when you do geriatrics or gerontology, you'll find that the older folks have a sweet tooth. Old people always want to eat sweet. It's a natural thing. Because it's like giving them energy. And that's nature stepping in.
What are you doing?
I'm trying to see if it didn't work. Yeah, I found that. It's in Spanish?
So that's what?
No. Let's do that.
What are you trying to do?
You know, when you speak to when you're talking to do you have your Siri turned on?
No.
Turn it on. You know how to turn on Siri?
What?
You know how to turn on Siri on there?
Turn it on?
Yeah, turn it
You
on.
have to go on settings.
Go to settings.
And then click the Siri thing.
There is all on my phone.
Settings.
And then just put it in the search box.
Bottom you see Siri.
Just put it in the search box.
Yeah, put it on the search box. Put
My
Siri.
Siri is on.
Yeah, click it.
Where's Siri? That's Safari. No, that's Safari.
My Siri is on.
You sure?
Yeah.
Alright, Siri search, right. Siri search. You need to have some kind of
Kind of what?
keyword, some key thing to get Siri on. Alright, so you can ask Siri questions.
Oh, you're
Alright.
so tired. See?
I don't want to see no phones in use today, okay? No phones. Put away phones.
Where was you?
Get into your
Go ahead, ask
laptop.
questions.
Navigate to those laptops. You are college students now.
Hey.
So you guys understand now why they infuse it through the hypodermal glycis? Because the fat is a lot. So when you infuse it through there, it's gonna travel all over. I believe that is what he was trying to get us to understand. When you do the hypodermal glycis, it's like you're infusing the liquid or whatever it is to the subcutaneous, right? Now,
So, alright, so you were going to look into our critical thinking. But one of the things you can do right away, without even going to critical thinking, but put you in the right path, is ask again the question, why subcutaneous tissue for glycis? And that will give you an answer. Why the use of subcutaneous tissue for
why do we use a subcutaneous tissue for glycis?
Here's what I found.
Why do we use the subcutaneous tissue for glycis?
I found this on the web.
Crisis.
I found this on the web.
Let's see what it says here.
what's the rationale?
It's usually an easy hydration technique suitable for mildly to moderate dehydrated adult patients, especially the elderly. The method is considered safe and does not pose any serious complications. The most frequent adverse effect is mild subcutaneous edema that can be treated by local massage or systemic diuretics. Approximately 3 liters can be given in 24 hours periods at 2 separate sites. Alright. Common infusion sites are the chest, abdomen, thighs, and upper arms. The preferred solution is normal saline, but other solutions, such as half normal saline glucose with saline or 5%
So
glucose,
what it tells you
is
is
safe.
that you can use multiple sites at the same time. 1. 2. The risk of you having things such as infiltration, which you usually get when you go with IVs, is what?
Low.
Lower. Also, although you give this for dehydration, you do not give large amounts. Give it very slowly. It's a little more than when you have a KBO, and a KBO is like. Why do you know we give it to something? It's a little more than that. All right?
Yeah.
That's what you're talking about?
Always hit always. Put it on always. Oh shit. Yeah, hit always. I bought this and I had it for like a few days. I gave it to my son, but I understood a little bit about it, but that's about it. I have a little boy, 6. No, he's cool.
Insulin. You should go there.
My only, yeah. My one and only. I want more. At least 3 or 4 more.
And the insulin is slowly absorbed, right?
Okay. You can. I don't know how to do it. I figured it out one time on my computer. I just don't remember how I did it. That's why I was hitting this, because I don't remember how I did it. There should be something once you hit it, Siri goes on. I don't remember what it was. Wait. Look at that. There's an H, right? So hold H, H. No. I'll get back to you. Okay. All right, let's move forward. Interesting. Very interesting.
Very interesting. Good. Very good. That will stimulate your be an incentive for you to learn. Look at it. See, crisis. But they'll only report that.
There could be like a keyword. You could set it. I don't know how to do it. Don't set it. Put a keyword, a key thing. Once you hit it, Siri goes on. I already got my key. Once I hit this and this, I hold it down, key Siri goes on.
Are you guys good? You guys understand where I'm at up to now?
No, sir.
understand the process.
Hey
right?
Siri.
You can relate to other situations and not just the ones.
Sure.
What if he said, can you feed somebody through the anus? Why? You're gonna lose it. That's why they do that. It's just like a person who wants pee. I love to see everyone. But it's any longer times and see from. So you're gonna find, we talked about this before. We said that when you go to that thing when the clean out your hair, you found it. No, I found nothing. When you go to those people that put the tube up your behind the attach it up machine.
Wash out.
It doesn't wash out. So when they do this, they gotta clean my hair, right?
Wash out.
They hook you up to a
Color mix.
but the machine can't really wash you out. All that machine does is administer the fluid in the right proportion. Because when you give it an animal, just push it in, open it up, and gravity do its thing. If you're doing the one with the bag. If you're doing the one with the fleet animal now, you push it, squeeze, it's inside there. And what happened? I'm not going to tell anybody to get anyone here. But when you get an animal, what's happening? When you give people animal, I'm not going to ask you pause if you have an animal. People start to be like, I can't hold your leg up. Seriously. You ever see anybody go like this? Yeah. You can't stick a walk like this, everything's going to come up. So just lock it in. I can run to the bathroom, right? Get it out. So what they're using the anal sphincter muscle that they have control over. But because of the pressure that we put in the anal sphincter, they feel like if they're going to become incontinent, they're going to lose it. That's why they do that. It's just like a person who wants pee. I love to see when women want pee. When women want pee, man, I got to go to the bathroom. You had to the bathroom fast, man. That's a woman, right? A man want pee, you like, yeah. So what you should do if you're driving?
Pull over.
Pull over.
Yeah.
Big cup you can't run.
I don't need a
And
cup.
rub somewhere and pee.
I'll
So
open
you
the
women,
front door
doesn't
and
show
I
you
pee.
you're
I'll open the front and the back. Exactly. I open my door and pee. Please.
The pee exercise.
Hell no, not me.
Pee exercise is good. I suggest all women do pee exercise. Kegels. K-E-G-E-L. And women do this after what? Childbirth. Right? So you can get that thing back in order. So 6 weeks later,
You ready for another one?
4 to 6 weeks later,
You ready for another one? Yes. You ready for another one? 3 months. 90 days.
I listen to whatever you tell me, but in my mind, they know that I'm 3 months. Because by 6 weeks, the husband pushing the pulling and touching. And what happens? They tell me 6 months out. Let me tell you why something. The older folks will say 6 months.
No.
I'm not 6 months, 3 months.
Yes.
Can't do nothing.
3 months.
But guess what? The mom can't wait 3 months.
Yes.
And
That's their
the husband
business.
come to you, and he touching,
Their
and he
business.
kissing you, and he touching in your areas, and nothing happened to you.
You not even sleep in the same bed.
Because he's gonna go find another woman, and do what you have to do to survive.
Amen.
When you have a baby,
So
you don't
it's
sleep
okay.
in the same
Talk about that, yeah.
I know. They're lying to themselves. All the time, a man should, or a woman should use the hands. By the way, let me just clarify that.
She said,
We are all gregarious. Please look for the word gregarious.
Look at gregarious. Look up.
Gregarious.
Look up gregarious.
G-A.
R-U-S. Yeah, go, yes.
What is the meaning of gregarious?
Enjoying the company of other people.
Enjoying the company of other
People.
people. We are all gregarious. Don't you see all the kids have been committing suicide
I feel the same way, baby.
since
Yeah.
the COVID-19?
But no baby.
The high
Yeah,
school kids, little kids, high school kids who know better, right? Have been
No,
committing
sorry.
suicide because they have not been able to walk.
You open the door for me. Yeah.
They were not able to talk and interact. Talking and interacting is a part of our culture. But not the culture of a specific group. Generally worldwide, we see people interaction. So, God made Adam and Eve. And over time, they're going to become Adam and Steve. Right? Or Eve and Yvette. But, we're still being gregarious. If you're going to go to Miss Palmer's, it's because, what? You have now
Madam.
socially bonded with somebody who either accept you or you don't like the person. So you're not gonna bond, right? To get intimate. So you don't have to use all those things. But in life, and
That's why we didn't bring
of
you our
course,
questions
I
today.
hear you guys, 3 months
Because he didn't do nothing about
a lot of
anemia.
times you don't reach 3 months. A lot of times,
He threw us a story
people
on
that,
anemia, but we
there you
didn't
go,
talk
pregnancy
about
have already occurred. Why?
anemia.
Men become very jealous of their own kids. Because at that time, the tension is on the baby, and the tension is taken away from them. And they become jealous. I'm telling you guys,
Haitian men know.
they have become, say what cultural thing, they have been doing this for centuries. The thing about now with the women, your problem is you get postpartum blues. You get postpartum blues. Because why? You don't think you're getting the support that you should have from your mind. So you get postpartum blues.
No.
And then it could get worse now, it become postpartum psychosis, when you now try to not only harm the baby, but you try to harm yourself. How many times do you hear about women take babies and put them in the what? The garbage. How many times you've heard that? How many times you heard that stepdaddy's taking a picnic and throw them through the window?
I'll tell you.
I'm telling you, this is a society, this is here in America, this is nothing back home.
It's true.
Because we have a bond. And people take this bond and look at it differently. A man may see a woman as the person that he will have sex with. And that's how he was. Bond with the woman. So when you can't have that sex for a period of time, it becomes what? Frustrated.
A worse animal.
Forget it.
That's it.
She shut it down.
That's what it is. And by the way, guys, remember this conversation, because this conversation will be coming up in your maternity nursing. That will be an integral part of your maternity nursing. But we're going to be putting it into the different time periods. In your intrapartum and then into your postpartum. That you need to know, we have to do that. So you already get an insight into it. So when you're reading, you're not just reading about the osteoblasts and all that stuff. We're going to be talking about what? Hormones. How the hormones have an effect on the brain. Do you know that when a man having problems, erection problems, it's due to what?
Jealousy.
Low testosterone levels, right? Women having problems. It could be due to their hormones in men. Women reach a certain age and do not participate in those type of things that you guys say we should keep away from it. Sort of thing. If you don't participate, then you get something called atropic vaginitis. When your man touching you to get him wet.
Big body.
Yeah, especially when you're getting up in age. And that's why they start to sell them different what? Lubricants.
To make it wet. To make it wet.
Because the body is not getting
In the wet.
wet. And if you keep this thing in mind that nobody not got the sex now. Practice makes perfect.
Amen.
And when you keep talking that nonsense, it goes to your head. You just start with psychology. When Tony like that, one peak. So you tell your mind to shut down, and it will shut down. Because it will lose it. That's a time that don't know.
Alright, let's collect also.
Let me tell you guys something personal to the topic. So everybody's good. What I'm trying to say is I got a call from old people telling me that I owe a whole lot of money.
How?
And I passed you. It's a party for what? I do not have credit cards. I only use
Sir?
what I got in the bank. If you got in the bank,
I don't use it.
That's when you don't.
History taking
but
specimen.
one day in October, I went there, the young lady said, I said, you have a pay.
What is history taking assessments?
Here's what I found.
I'm doing my research, sir. Let me do my research.
That ain't research right now. This here is just review that you did before.
Is the second
Hmm.
provider of information about the patient to enter review will provide vital signs of environment. What do you have?
I'm
Everybody have different things.
trying to find, I don't know why. Let's see, explain this. It's a review. This is what I got,
Is there
guys.
more information about the patient, provider history,
Listen,
interview? What
that's
do you
what I
have?
got. The ability to obtain an accurate medical history and carefully perform a physical examination is fundamental to providing comprehensive care to adult patients. Right? In particular, the internist must be thorough and efficient in obtaining a history and performing a physical exam with a wide variety of patients, including healthy adults, both young and old, adults with acute and chronic medical problems, and adults with complex life-threatening diseases. The optimal selection of diagnostic test, choice of treatment, and use of subspecialists as well as a physician's relationship and rapport with patient all depends on well-developed history taking and physical diagnostic skills. These skills, which are fundamental to effective patient care, should be a primary focus of the student work during the core curriculum. Knowledge each student should be able to describe the significant attributes of a symptom, including location, radiation, intensity, quality, temporal sequence, onset, duration, frequency, alleviation factors, aggravation factors, setting, associated symptoms, functional impairment, and just what I have. Health history. The purpose of obtaining a health history is to gather subjective data from the patient and or the patient family so that the healthcare team and the patient can collaboratively create a plan that will promote health, address acute health problems, and minimize chronic health conditions. The health history is typically done on admission to hospital, but a health history may be taken whenever additional subjective information from the patient may be helpful to inform care.
It's the same thing.
Yeah. So,
You could Google it. You could go to YouTube. You know that, right?
yeah.
YouTube.
All right. Guys, listen to me, please.
Okay, ready, Sister
The
Jody.
exercise you're going to be doing now is what your nurses normally do when they go out into the clinical areas. So what you will be doing, and listen to me very carefully, I want everybody in these two groups get a large sheet of paper or to be writing on both sides. Get a sheet of paper, please. Well, you have like one thing, you don't have problems with paper. Get your paper, close your laptop. And these two groups, just stand and go to that side, please. Stand and go to there. And don't ask me nothing, I don't know.
I don't want to tell you anything. I don't ask you nothing.
Don't ask me nothing.
Mr. West, but if the patient don't give me two diagnoses, what I'm supposed to do then?
Give you what?
Only one diagnosis I have on the case.
Guys, don't get him back into your team. Just
Work with it or
get back out
I
into
could
the
have
areas.
what I want.
Spread out, please. And do your own individual thing.
No.
The
I could have what
person
I
who,
want.
well, as a patient, you can utilize that, and based on what you're saying, to do an Act 5. The patients, you just utilize What is your diagnosis? Your medical diagnosis? And come up with a plan. Whatever your medical diagnosis, you go act fine.
Como fez, no business? Como fez?
Right, you put out time, you do the plan on your own, based on what is your. Natural. You guys don't have to be, you can do anything you want with this. You don't have to be in the group. Do your own thing, do your own thing. Right now, you do your own thing until 7:30. Until 7:30, you do your own thing. Now after 7:30, it's like fast, rapid movement, plenty of movement. So please, you have, right now you have 40 minutes exactly. That's a lot. It's actually fast, because you exactly what it was. And they started already, right? So you guys got everything going on. You're the lucky ones to go, you're the stars. Oh.
I'm just happy. I'm going to mais ça va faire sens.
This is what she said.
Okay, so that's an offer. Okay.
Sandra, what was your diagnosis again? Tell me, I want to verify. Okay. Okay. No, he said you can tell me. Letitia. Letitia said you can tell me.
He said that?
Yeah. Yeah.
What he said.
Oh, okay.
The name and date of birth and everything. Because then it's like,
Yeah, it was right. Huh?
I'm gonna put you as a history.
Okay. Very good.
Three. Oh, good.
That's the back.
1998.
The background?
That's the back.
Right. Oh boy.
Record letter. She's been having pain.
He was doing that one prayer. What is your last word? Last name? Say is there. Sileus? Oh, okay. Oh.
Stomach.
So, get some
Why do you need to put my birth? No, just make it a card. Oh my God. Quand elle est venue? Oh, okay, no, that is oh wow.
At night, she vomited. And bowel, wait, madam, bowel the dark, right? Dark BM dark. Dark BM, right?
Cherry. You hear me?
What?
You hear me for real?
Sorry.
Cherry.
Oh, I'm putting it away. Okay. I'm definitely gonna know where the chest came from. Came from nice. Came from nice. Yeah, I have it. Manually. Nitin. Go. Remember those? Wow. Huh? Okay, use one. There. Let me give you one that you can see. Here, pass it down. Thank you. So much. No, Jack said it's the vital sign. You gotta put some vital sign. What you see, that's what Jack. Wait. Wait, 1 minute vital sign and I'll just vital sign. We did that. Remember? Wait. No, go ahead, wait. Because we get some champagne. So we go for remember. And we'll do the vital signs. What did we say the temp was? She's under the the temp was 99. One oh one. Was 145 over 900. What? C'est bon la joue, hein? The respiratory was respiratory oxygen, right? Même barre avec oxygen. No, respiratory was 25. And pulse was 90. Bon? Okay.
Blood sugar? Blood sugar? Your pulse?
Oh, abdominal. So the jump patient had abdominal pain. So that's the check-up on the jump. So my mind patient had abdominal pain. Right? But she's in the middle of her abdominal. Assess the So assessment will be the patient what? Assessment. Yeah. So we're gonna assess the patient with that. Vomit in the blood,
Okay.
right? If she's having abdominal pain, she's vomiting blood, so put her down.
You got a t-shirt to avoid aspirin, alcohol, caffeine, and spicy food.
No,
And
so she having so what would be her thing? I put the patient is having abdominal pain.
okay, yeah. She's definitely having abdominal pain.
But she says in the
Definitely.
middle.
Mhm.
She says she having pain.
She's saying from the left of her
No,
breast.
she said from the chest.
Right. No, she said from the left of her breast
No.
down to the navel. Right. That's a rupture. That's a ruptured ulcer, by the way.
She said she's in the middle of her chest. She's having the pain.
Okay.
So if the middle of her chest, that's what. That would be stomach also, right?
No, it's not stomach ulcer.
Oh, chest pain.
Yeah, she already told me that it's duodenal ulcer. She was trying to explain to us.
Oh, duodenal also.
Yeah, duodenal ulcer.
So the patient having a duodenal
That's
also.
still in the stomach.
That's the
That's still in the
stomach
stomach.
pain. So what should I assess the patient with that?
Yeah. Where you get this from?
I had it. I did the homework. Assess the patient. Assess the patient for the sign of the hematoma. Hematoma is blood in the poop, right?
Hematemesis?
Yeah. It's vomit. Yeah. No.
That's vomiting. Look it up.
No, that's a homework.
Isn't he said we
Can't
do
look it up.
It's
Can't
no
ask-
homework.
Yeah, but you can look up the word.
It's vomit in blood. Yeah, it's vomit in blood. Objective patient pain.
I just told you. What is a vomit?
Assessment for the signs.
Huh? Oh, mama kita balik kita. Dia orang mau lebih
Yeah. Yeah, she's
And we have to put in the assessment. We saw abdominal distension.
I'm not, I'm not in your group, right? I didn't have Sandra. This is
I'm talking to her.
Oh.
She's not in your group either.
Be quiet.
We have to put abdominal distension, right?
Novena is when you're pretty close. That's in the novena is when you no. Oh, patient medication.
By what?
7:30.
Mm-hmm.
So persons were
Russian.
Speeding up.
trying to do time management.
Yes.
As nurses, you have to do what?
Time management.
And many times you have patients who come onto the floor. And when they come onto the floor, you have to have a nursing process in place. Still doing what else you have to do, plus that.
I was done. I was done with mine.
So what you had just now was an exposure in a hospital situation.
Mm-hmm.
In the nursing home, they're going to tell you 48 hours. In the hospital, immediately. They call up from the ER to say, patient coming up to med-surg unit. And this is the diagnosis. And you start right away. You have your actual and your potential. Yes, they have these things in the computer, software, put it up, bam, bam, bam. But you have to do what? Make it specific to your patient. This is time management.
Yes.
And you also got to remember, you still will be giving your medications, you still be doing all the other things that you're supposed to do. So start to get accustomed to this type of thing because this is what it is. Right now, with the COVID, you see, for those who've been following the news, nurses have been doing what? Protesting across America. Because they cannot
Cope.
They cannot get things that they want done correctly. Some have put up all the requests they have and they form a long line around the block because none of those requests was
Address.
fulfilled by administration. And after coming to work, people were dying, they were dying too. So what I'm trying to say, it is, nursing is stressful. And what happens with stress with nursing, it causes what something called burnout. And you hear a lot of nurses are leaving the field because they're burned out. So what you had today was an example, a sample of what pressure can be.
Make me burn out right now.
One of the most important things is listen. Listen carefully, be observant, and know what's going on. Don't stay in your mind and tell yourself, this is what I'm going to be doing. Remember, you have different disease processes. When we did celiac disease, Crohn's disease, irritable bowel syndrome, they all had what? Diarrhea, abdominal pain, and what have you, right?
You just move.
But you could not treat all of them the same way. You have to treat based on their what? Underlying cause. So please understand this and work with it. So that when you are confronted, whether it's in exams or anywhere, you know what is the principles, and that's what's very important. The principles of nursing. And right now, know your scope of nursing. Because right now you're working as, or you plan to be, registered nurses. And registered nurses' scope of practice is far different from that of an LPN or that of a CNA. Please take the time to go on the computer and pull up scope of practice, registered nurse. Not now, of course, when you're home. Scope of practice. Every nurse have a scope of practice. That is legal rights. There are certain things you can do as a registered nurse, and there are things you cannot do as a registered nurse. And you have to know those rights. So please,
Like I
take that
cannot start
time
an
and
IV.
go and look at scope of practice.
I know I'm an LPN. I can give IV.
And then when you go to work at facilities, you'll be following their what? Policy and procedure. And if you go outside the policy and procedure, you're up a tree without the what? Whatever.
She's one
Not
of
as if of the
the
criminal
She told me
animal,
about
right?
it.
But I'm serious,
No,
guys.
she's not
Please
ready.
read it up. Please read it up.
She did for
Right.
physician assistants.
You got a little sample of being what
No,
stress
it's
is like
got
today? You
PTC,
see how you start to some people start rationalizing.
vitamin.
Didn't do. You didn't hear it. Nobody tell me.
Similar program to this.
All right, guys. All right. On the last day, we look. Stay with me, please. We said we're going to look at anemia, right? And I give you words.
There you go. I
Oh
told you.
boy.
I give you what? Microcytic anemia,
Macro.
macrocytic anemia,
Normocytic.
normocytic anemia. I give you aplasia, aplastic anemia.
Hemolytic.
I give you hemolytic anemia.
Hemorrhagic.
I give you hemorrhagic anemia. All right? But remember what I told you guys when we were talking about it yesterday. I said there are many different type of what? Anemias. In fact, there are actually hundreds of anemias.
Yep.
But those categories that I give to you, you find under these categories, you have different type of anemias. Now, basically, in the layman's term or a simple way, anemia is when you have
Deficiency in hemoglobin.
in the quantity and or quality of your
Hemoglobin.
blood cells, of your red blood cells. Listen to me again. It's a deficiency in the quantity and or quality of your red blood cells.
Okay.
If you don't have enough, you can't carry oxygen. And if the quality of the cell, like sickle cell, is not there, you're going to still have the same problem. Food. We did nutrition. Nutrition, or lack of, can cause anemia. But a lot of anemias has nothing to do with the actual eating of the food. A woman having fibroids, she's bleeding and bleeding. She's losing blood. If she's losing blood, she's losing what? Hemoglobin. And hemoglobin is iron, right?
Yes.
This was check on, right? So if you're not losing this hemoglobin, it's going to drop. And we must know what's the normal hemoglobin level. Because the normal hemoglobin level will say whether this person should be getting what? Iron pills, or whether you'll be giving them a transfusion. Are you guys with me?
Yes, sir.
So please remember the ranges for women and the ranges for men. They got some people walking around with 6 and 7. I'm serious. 6 and 7. And just look at it. When a person's hemoglobin is low, they look what? Pale. Pale. So appearance is a lot. You look at the person, you can see. Look at the eyes. The eyes look what? White. But then when you have another type of anemia, you have massive breakdown of the red blood cells that now the eyes is not going to be white, it's going to be yellow. And yellow is not a disease.
It's a manifestation of a disease.
Yellow is better known as jaundice. But it is a manifestation of a disease. What you see. And we could have lots of different things. We could have hemophiliacs, mother passing crap on to her son, genetics, right? Yeah. We could have sickle cell anemia, both parents
We have it in.
involved in it. We could have patients having malaria, parasites going and hang out in there. Patients can be having tapeworms and hookworms, meaning they're doing what? They're taking your blood. So you'll get what? Anemia. So it is not just sitting and eating the food and knowing what food possesses,
What page was it?
but you have
Mhm.
other
Page.
causes
Anemia?
of anemia.
This is
Because the layman, when the layman hear anemia, all
Mr.
he's asking
Duncan,
about
you're
is
in the
what?
right, you're in the right
He
place.
ain't eating good. He ain't getting enough
You're not,
food.
you're not.
But we know a
Can't you
lot of the
search?
problems you get
You can search.
is not related to the patient not eating. Now, when you're upstairs, I asked you to look up something called failure to thrive, right?
927.
And what is failure to thrive?
Developmental delays.
No, we don't get it.
No, you have the
Absorption.
You're not in the percent.
You see we did last week, right?
Percentile.
Failure to thrive.
900, right?
You gotta put
927.
it together what we did. Look back at failure to thrive. Please look back at failure to thrive.
Explain failure to thrive.
See how you can put it into the
I found
context
this on the
of
web.
everything we're talking about.
What is failure to thrive? You want me to read it?
Nadij, why are you disturbing them people, eh?
Look what it Why?
Failure to grow or maintain weight. We have kids
Later.
that are not growing and they're not putting on weight. A lot of it happens in pediatrics. And we have to do pediatrics, right? This is part of what we gotta do. Pediatrics. We have children,
I have 10.
and when we did maternity nursing, we had looked at the postpartum, and we looked at neonatology, infants, preschool, adolescents, and we looked at what happened during those period of times, right? Now this is where it comes in, where the activities of these children and the problems that they get, that will be your pediatrics. Failure to thrive is going to be there. And the kwashiorkor that we talk about, and the marasmus that we talk about, and where we have problems in the intestine that prevent absorption. And what is being absorbed in the intestines?
Nutrients.
What nutrients are being absorbed in the intestine?
The protein.
Everybody saying protein. But y'all don't eat meat? Damn, guys.
Carbohydrates.
Carb, meat.
Fluids. Electrolytes too. Everything from the food. Everything from the food is.
So what is amino acids? What's amino acids?
Sugar.
Okay,
What is amino acids?
Here's what I found.
what is amino
Amino
acid, guys?
acids is where the organ compound that contains amino carbohydrate
Tell them.
function.
Tell them louder.
Oh.
Is that low? The end product of protein digestion is.
Amino acid.
Did it say?
Oh,
So what absorbs an amino acid?
Food.
No, what absorbs it?
The intestine.
Your intestines. Which part of your intestines?
The small one.
Hell no, the large intestine.
The small one. The small intestine.
Alright, but when we start talking about the small intestine, which part of the small intestine is
Jejunum.
absorbed?
Jejunum.
The what?
Jejunum.
Ileum and the duodenum. Remember yesterday we were talking about the what? The jejunostomy?
Yes.
Guys remember?
Yeah, you have to.
And why they put the tube in the jejunum? You gotta make this connection with the enzymes, you know. In the duodenum, what do you get coming into the duodenum? What comes into the duodenum? The stuff come out. The chime, right? Comes down there. What else? Because we talked about you using the jejunum, right? To put the tube in. Because the person's stomach is bad and they cannot do a gastrostomy. That is why you do a jejunostomy. Because the stomach might have cancer. So they can't put a tube in the stomach. But why not put it in the small intestine, in the duodenum? No, preference is going to be where? Jejunostomy, because the small intestine you have absorption taking place. And you have bile coming down. And what the bile is going to do? The bile is going to emulsify the fats. You have trypsin, amylase, lipase coming from the pancreatic plus insulin, right? All coming into the duodenum through opening called the ampulla of Vater. So you still have what? Breaking down taking place there, right? And some absorption. So the rationale, once you understand that, you'll not have a concern. Right? Why they do the jejunostomy? We went through that, right? We even talk about ileoconduit, right?
Yes.
And ileoconduit is when what happens? What happens when you get ileoconduit? Why do you do ileoconduit? Because the bladder had to be removed. So now they're going to use your GI system to facilitate a problem in your urinary system. All right. So with anemia, let's have microcytic anemia. And what is microcytic anemia? The blood cells are smaller than normal. Small. So if they're small, it means what? The hemoglobin. Not gonna have a lot here. Small.
Yeah.
Don't be a problem. And that's gonna lead to anemia. Now it's opposed to macrocytic. You have a whole lot of
There's a large blood cell.
large. But
They are normal.
we don't have enough of them.
Yeah.
The big, the filling up the room. Run out of space for them. So they're not carrying enough of what's supposed to be going on. Then you have normocytic anemia.
Not enough red blood cell. Not enough red blood cell.
It's taking a long time for the red blood cells to mature. And then you looked also, you want to look at also blood volume. If the volume drops, it means you're having loss of what? Cells and plasma are being lost. So your patient to become what? Anemic.
Anemic.
I want you guys to look at it. That's why I give you in categories, because you have so many different types of anemias. And I want to look at it in specific categories. Specific categories. Now we looked at the hernias, the umbilical hernia, the strangulated hernia. What are those? The hiatal hernia. Talk about that. Talk about what you need to do as a nurse. Understand is what? Surgical intervention to take care of that problem. We look at types of feeds, right? And this afternoon, this group here was talking about that. Hypo, what? Hypodermal crisis. And anybody from the group want to share with the team what's the reason for doing the hypo? Why, they do the hypodermal crisis? Anybody from this group?
The hypodermal crisis is done because it's being connected to the subcutaneous. And the reason why it's been connected to the subcutaneous because that's where the fat is at, and you have fat all over your body, and whatever is being introduced would transport faster, and also you have a less likely chance of catching an infection when you do hypodermal crisis.
And also, just say with it too, is that we're doing the hypodermal crisis. You don't get a lot of fluid. But what you can do is use multiple sites. You can use the abdomen, you can use the arm, because adipose tissue is found all over the body. So you can utilize it. Hypodermal crisis. You have infusions. You have GTPs. You have NGPs. And along the line with the NG, we talk about gavage. We even talk about poisoning. We talk about lavage. And at that time, you need to look at the different type of microorganisms that can cause poisoning. We spoke about poisoning being what? Intentional or accidental. We had also spoken about intestinal obstruction. And what causes intestinal obstruction? Today somebody asked me about volvulus. I give you some words before. And what was those words? Come on, you guys will just read it off to me. When the telescopic is each other, it is known as
Laparostomy.
what Rose tell them? Intuition. telescope. And then when it's twisted, no, not there. Marvelous. What else can cause it?
Right?
Fecal impaction. And fecal impaction, we know, is a sentinel event. And what is a sentinel event? You guys looked for it the other day. Phew, that's a week ago. What is a sentinel event? And as registered nurses, you have to know what a sentinel event is. Not maybe.
Accidental.
What is a sentinel event? We did it last week.
Weight loss,
A sentinel event.
ulcer,
Weight loss, ulcer,
impaction,
fecal impaction,
Sentinel events.
unplanned weight
Here's
loss.
some news.
That's not so new.
But what is sentinel event? You gave me types just now. You
What
list
is
types, but
sentinel
what is
event?
sentinel event?
Accidental.
Here's some information.
Accidental.
When you get a sentinel event,
if you break
Here's some
you
information.
can lose your job because a patient is not supposed to have fecal impaction.
you're not supposed to lose weight.
Why a patient is not supposed to have fecal impaction? We're in GI, so talk. Why is a patient not supposed to have fecal impaction? Because you registered nurses supposed to ensure that your CNAs tell you what? The bowel movement. So the patient not having bowel movement and they don't tell you anything, you can have a problem. But you know what? Most facilities have the software now. So when they put it into the system, it goes straight to the MDS.
Yes.
And they know if the patient had bowel movement or not. But if the CNA is lying because she had something to do, she said, oh, he had a bowel movement, but person never had no bowel movement, but you put it in anyway.
You got it.
There you go, baby doll. Right. And that happens. And you see bowel movement. But then again, even if the person had a bowel movement, they had a little something come out. A little something squeeze out. So now what's going to happen? The patient going to start to do what?
Vomiting.
Vomiting. Run the temperature.
Mm-hmm.
And right away they say,
Big.
check to see if he's impacted.
Yep.
And they want you to do what? How do you check?
Okay. Finger.
It's called a digital.
Who do that?
Look up the word digital rectal examination.
Digital rectal examination.
Here's what I found.
The nurse does this. You, the registered nurse, put your fingers up in the man's butt.
Yeah, you have to.
No, certain thing you don't know. You do it.
You gotta put your finger in the man's butt.
I had this one.
Yeah.
I was so lazy.
Do you see the digital?
Yes.
What it says, somebody read, please. And guys, this is not just a conversation.
It's true.
We are
Yes.
discussing and you're learning and you gotta what? Pay attention and remember these things and put it into the right context. Person is constipated. This is could be a reason to do this. Because if the constipated patient don't have a bowel movement, they're gonna end up with fecal impaction, which is a sentinel event, and people can lose their job, especially if the patient dies. Harm due to neglect. That come under patient abuse, neglect.
Oh.
Guys, stay with me. It's not fun. It's serious. Neglect is patient abuse. And no patient is supposed to get fecal impaction. No patient's supposed to get bed sores,
Well, they do.
because if they get bed sore and the family is smart enough, they go and what? Sue. And the facility will pay. Unless there's a doctor's note that says the bed sore could not be avoided. It's what it says unavoidable bed sore. If he don't have that in, and he better put why it's unavoidable. Because bed sores is indication of poor care by the entire team. The CNA is not touring the position of the patient. And then when they pick up that the patient started at stage 1, did the dietitian do an assessment of what the patient is eating? Do we know this patient requires what? Protein supplement to promote wound healing?
You don't want to eat.
And you guys will be the persons who are what?
I'm gonna do that too.
You are leading that team. You're responsible for the care plans. That is why this here, nursing process, is your life. Registered nurses, that's your life. When you go to college, from day 1, that's what you get. That's your life. Understand the nursing process. Understand it inside out. And I've been telling you guys, do it. Every time you got something, do it, do it, do it, do it. Because while you're doing it, you are what? Learning. You're learning the different diseases. You're learning how it manifests. And you're learning most of all what you're supposed to do as a nurse. And you're also learning what the others are supposed to do. It's not just about you learning, but you're learning what other people are supposed to do. So we got to look at this and please look at it. And you'll be good. You'll be good.
Going to read the digital rectal.
Say again?
Digital rectal examination.
All right, read the digital rectal examination.
Digital rectum examination or rectal examination is an internal examination of the rectum performed by a healthcare provider. The examination may be used for
You heard that
diagnosis.
story. By what?
Healthcare provider.
Not only doctors.
Right.
Oh, yeah. Just want to make sure you understand that. Because I did so much in my lifetime, it ain't funny. And when somebody pushing your finger like that, you got to hook it, and pull out.
You have to.
I've done it so many times.
Yeah, me too.
Maybe I gotta change my field.
Especially when you do pediatrics.
I did.
I have those little kids. Come on.
Sometimes they tell you thank you.
Yeah, they do business.
So,
Business.
Read it.
Continue.
Yes.
This examination may be used for the diagnosis of. Everybody.
Let's not guys.
Focus. All right. This examination may be used for the diagnosis of prostatic disorders, benign prostatic hyperplasia, and the 4 types of prostatitis.
Prostate. You know what? For the guys in here,
Prostatitis.
when you go to your doctor and you're over a certain age, he or she will want to put their fingers inside your butt to see if your prostate is enlarged. I'm telling you,
It's true.
that's what they do. They push the fingers inside there and
They do it like
check to
this.
see
If
if it's enlarged.
it's enlarged or not.
Digital examinations, yes.
Oh.
All right. Well, we talking about digital removal of feces, not just a digital examination. Basically, what you're doing, guys, is putting your fingers in there either for examination purposes or for the removal of impacted feces.
Yeah, I heard.
Okay. At times, when persons have what? A person may have bad constipation. Guys stay with GI, right?
Mm-hmm.
Move up GI. Boys have bad constipation. So what do? What's the first thing you think should happen?
Take like a lactulose. They give them a lactulose, right?
No.
No,
What do you
fluid.
think the first thing should happen?
Water.
What is it?
Or abdominal examination. Abdominal examination for distension.
If the patient is
If a person is constipated, don't mean they're having fecal infection.
no.
They mean the possibly they're on their way to fecal infection. So you gotta take a what? A history. When is the last time you had a bowel movement? What is your pattern like? Do you have a daily bowel? Or some people say, no, I go every 3 days. Right? So you gotta get the what? That history from the patient. And if the patient now is worried and say, you know what? I go every morning, but I have not gone for the last 3 mornings. Then you will what? Wonder why? And you're gonna be what? You're gonna palpate.
The abdomen.
You're gonna inspect the abdomen. You're gonna palpate the abdomen.
To hear.
And auscultates.
You're gonna listen to see if you're picking up the bowel sounds. That's what you can do as a nurse, right? But that's like one of the first things you do.
That's the worst. You can't give the patient something to eat or drink.
Drink.
You come to it. So now it depends upon what's happening to the patient. You're the doctor, not you, may order some kind of fleet animal. They may want to evacuate by giving them
No, that's good.
They
Enema.
may give
Enema.
Milk of magnesium, lactulose,
Enema.
Colace, Senna.
rectally you can give a suppository,
Yes.
right?
Yes, you could give
Push a suppository up.
That's not the first approach. You wanna give like Senna, right?
When you're in the hospital, they don't give you Senna to drink. They give you Senna tablets. You can get up and move to the counter, right? MOM, milk of magnesia, right? But normally, when a person is constipated, right, depending on the doctor, he may say, give him an enema to cleanse their
Rectum.
down there. Because the person, depending how the person is complaining. Because if you now give them a laxative, it may not work
Right away.
as quickly as it should. You got some people, you give them a laxative and they don't go. You gotta go and give them more. And then when after get more, now they start to run all the time. So it move from constipated
You gotta give
to
them
diarrhea. Right?
Oh yes.
So that there got to be monitored. But what's important is knowing the frequency of that person's bowel movement or bowel habit. Also, the pain that that patient is complaining of. Because the doctor may order straight up, which is an x-ray, and when they go, they see the what? Fecal infection. Or if the patient comes from a nursing home, and you go to the hospital with fecal infection, the hospital is going to call the Department of Health. The hospital will call DOH because it means it was poor nursing care.
So a patient can have loose stools, but they're still impacted.
A person can, and that is something called retention with overflow. Something that's happening in urine, it can happen also with when a person is
Feces.
having intestinal obstruction. You have some things seeping around the edge and coming out, but they're still very much
impact.
impacted or have the intestinal obstruction. It could have a whole ball of worms inside the intestines. A ball of worms that can cause fecal infection or cause intestinal obstruction. Believe it or not.
That's crazy.
You know, I was looking today at 6 of the most deadly fishes in the world. And one of the fish that is a really bad fish, it is not something
That's me and my baby.
in the sea that, like the bray or the barracuda or the great white or shark or something like that. It's a tiny little fish. Very, very tiny.
Went to a party.
And he follows urine. He loves urine. And when you go to swim in those rivers and creeks, he finds his way inside there. And when you go in there, jolly old time, he starts to eat and develop inside there. And he's on one of the 6 most deadly fishes in the world.
Damn. Nice.
You see a shark coming, but you don't see all these little guys swimming up into you. And because of love, they want to smell urine. And some of us is pee myself and we don't know. Some of us laughing and everybody party going on and jump in the water up so nobody can see that.
Yeah, they see water.
Yeah, no very wet.
Yeah, they see water.
Oh, but let me stop. Anyway, the thing is, with intestinal obstruction, you can have so many different things happen. And you can use, as person say, he was saying what? Use what? What did he say you can use? Laxative. Doctors do not like you to use laxative. They believe in a natural bowel movement. Because what? You are now training your body to take up laxative when you can't go to the toilet. So what you should be using? What you should be telling the patient?
Drink a lot of
Fiber in the
water.
diet. So, President, fiber was fiber. That thing that is put in mattress?
No.
Just pack the mattress to sleep on, like back home?
No.
That's fiber, isn't it?
You know, you want them to eat like
So what food you got with it? Source of food of fiber. What is the source of fiber?
wheat bread.
What? Lord have mercy. Wheat. Only wheat?
No. Vegetables.
Sources of fiber.
Now you see how these things
Here's what I found.
little things like that?
What?
What is a source
Pear.
of fiber?
Pear. Pear.
Dry fruits.
Pear.
Dry fruit.
No, fruit make you go to the bathroom.
We have pear.
You know, how long did we say the intestines is? How long we said the intestine can be over 20 feet, right?
Yeah.
Now your intestines could stay from here and go past the wall over there.
Damn.
So you know how much feces can be in there? Some people eat something and they seal part of it a couple weeks later. They eat some, what one is called, I always check it out, corn. And then about 2 weeks later, they see corn. Because it got a lot of crap packed up inside there. And the corn didn't come out the normal percent time because it got a lot of crap. Up your belly look nice and flat and, but boy, if you know what's going on inside that belly. And if you back up, you're going to have problems. You are now causing the whole system to be screwed over. Including absorption, all those nice macronutrition and micronutrition. So you have to tell the patient what a nice, using the fibers, lots of what? Fluids. And what else?
Strawberry.
Right.
Yeah, fruit.
Alright, what else?
Potatoes,
What else?
apples, beans, wheat,
What else?
strawberry,
What else?
No, not banana.
What else?
grains,
Banana.
Exercise! Exercise! Everything you do, exercise. And I'm glad I got Marie in the back. Marie could tell you about that exercise, right, Marie? There you go. Exercise. Alright? Because if you don't, the thing gonna pack up in you. And then when you go certain places, you get some slight little gas come out. And when that little gas come out, it look like this. Just clear out the whole room. And then what you is do? You stop like, why who do this? But you know down well it's you. Because you didn't make a noise, it is what? A silent attack.
That's the sign that kills you.
Silent
Oh
killer.
my God. So you have these silent attacks, you know. So social gatherings, it can be a problem. But you must cleanse out because you can have problems
WMDs.
with the GI system.
You could buy these things survival insurance. Like something that can make you cook.
Oh,
Then you
yeah.
got GI when you gotta do what? Over 40 you do what?
Not for
Colonoscopy.
me, yes. That's what you do for my mother.
And you say, I said there's something you look for that in one of those, not just cancer. What else you can look for? Polyps. And what else? You guys used the word today while we were talking. Mm-mm. You have polyps. What else you can find inside there? The polyps go out. This one go in. It's a D word. Diverticular. Diverticulosis. Guys, look for diverticular, please. Those are common
Look
things,
up
guys.
Chrome
Common,
for
common.
diverticular.
Okay, searching for Chrome
And
on
when
the
you
App
got it
Store.
all backed up with whatever inside of it, you got diverticulosis.
Look up diverticular in Chrome.
Somebody read what is it, please? And
Look
look,
up
please look at an
diverticular.
image. I want you to look at an image of
Look
the
up
polyp and the
diverticular.
diverticular so you can make that
Weather for
comparison.
where?
Look up diverticular.
What is it? What is it? Pockets. Pockets in the intestines. So if you have pockets in the intestines, where do you think it's going to go in there?
Here.
And then the food is going to cause a problem. It's just like how we talk about you when you get what? Appendicitis. That little thing at the bottom of the
Here's what I found.
colon there. Feces going back up in there. And that's what ends up with appendicitis. So that feces that you got inside your body
Here's some information.
is a bad thing. It's a bad thing. And people don't realize how bad it could be because they're too busy to learn when Mother Nature says
Here's
go
what
to
I
the
found.
bathroom. They got things to do. Right? But when you gotta go to the bathroom, you gotta go to the bathroom. Right? Do you find the times that you've not been going to the bathroom, then one day you get some bad diarrhea? That's Mother Nature cleaning you out. Because that one day you didn't eat anything, but that one day, Mother Nature said, a lot of crap. And you've not been taking care of the crap. Okay? Remember, the large intestines where stores the food is what? Food that is already being processed. It's the end product of digestion. You guys with me? I like how you say this thing, Natalie. Yes, sir.
Oh.
Oh. Oh. That was you, man.
Oh.
Really?
Everybody's
Why
only.
everything that smells good is bad?
What's the
No,
question?
that's not your statement. You guys, don't listen to this guy, you see? Because every day is his birthday. He's saying that everything that smells good tastes bad.
No, it's bad for you.
No,
or
he
tastes
meant to
bad?
say it's bad for
Oh,
you.
it's bad for you.
He meant to say it's bad for you.
What are you trying to say?
He said everything. He meant to say everything that smells good is bad for you,
Right?
or everything that tastes good is bad for
It's
you.
bad for you.
Yeah.
Which one?
Everything that smells good tastes bad.
What do you mean?
That's the only, that's what he eats.
Maybe you,
I don't
maybe
know.
you can't cook.
That's subjective.
All right. Let me make everybody a little nauseous.
No, don't do that. I'm
I
pregnant.
will do make you nauseous.
I didn't eat supper yet. And I'm eating at the
People who
And I'm hungry.
do not pay attention to cleanliness and hygiene when they go into the bathroom
Yeah, when you go after them.
and the bedroom,
Stank.
they got whatever in that area, right? And you say you gotta wash up, you gotta clean, and what have you. And then we have these people who got a lot of money, rich people.
They don't want to spend the money.
People who fall in what category? Like you, rich like you, of course.
Go ahead, girl.
Right.
You know, lower middle class, upper middle class, and that sort of stuff. And these are the persons who happen to be very adventurous.
Mm.
And these persons will engage in
Everything.
anal intercourse.
Yes.
And when they engage in anal intercourse, guess what happens next? Oral intercourse.
Oh, Lord.
So if you have something going inside the butt, and then you're licking it afterwards, what do you expect? So you get E. coli, and it's not anything that the person eats. It's something that the person sucks.
Stop.
Yeah.
And that's true. Guys, that's the truth.
Yeah, he's being honest.
You want to believe it or not, that's the truth.
Antibiotics don't treat it like
So what should you advise person who like to do it all anal intercourse?
Antibiotics.
You should advise them that they should do what?
Do it as a right, as their own right.
Wash their whatever
Their ass.
before putting their mouth in it.
Clean it up.
Time is
Or,
running, teacher.
or
Time is running.
do it.
You getting them, you know.
Okay, it may sound disgusting, but it's a real situation. And people who have been getting E. coli, it is not only from eating the,
Food.
what does food place's name?
Vegetables.
That's around the corner there.
Chinese food.
Chipotle. And these people that always got something going on with the,
Wait, Chipotle?
yeah, they always got things getting on with the E. coli and what have you. Things that's been feces is come up with their salads.
Oh.
So people been doing, so they've been getting
I don't want to eat that shit.
because it's coming the feces on the fields and past.
Take a picture, put it
Guys, I
on.
know some of you do not like to know the facts. I know the real things in life, but what I'm talking about
It's
is a
true.
real thing.
Yeah, he's telling the truth.
I mean, some of you just ask me like you're doing it. I don't know. But we don't want you to say anything. Because what happened in Vegas?
Stay in Vegas.
So whatever you do in your bedroom,
Stay in your bedroom.
there you go. Don't come and tell nobody. Alright guys, I'd like to thank you for sharing your time with me. You do have my assignment next week, and I'm not going to ask you for it, but I expect you to bring it in.